Welcome to a presentation about Wilson's disease brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. Wilson's disease is like a car that has a faulty fuel filter. The fuel filter is responsible for filtering out impurities from the fuel before it enters the engine. In Wilson's disease, copper accumulates in the body and acts like an impurity in the fuel. This copper builds up in the liver, brain, and other organs, preventing them from functioning properly. Just like a car with a faulty fuel filter can't run properly, Wilson's disease can cause serious health problems if left untreated. Wilson's disease is a rare genetic disorder that affects the body's ability to regulate copper. It can cause copper to build up in the body, leading to serious health problems. Symptoms of Wilson's disease can vary from person to person, but may include abnormal liver function tests, jaundice, yellowing of the skin and eyes, fatigue, abdominal pain, nausea and vomiting, loss of appetite, muscle weakness or stiffness, tremors or difficulty with coordination and balance, behavioral changes such as depression or irritability, difficulty speaking or swallowing, changes in vision such as blurred vision or sensitivity to light. Wilson's disease is a rare genetic disorder that affects approximately 1 in 30,000 people worldwide. It is more common in certain populations, such as those of Mediterranean, Middle Eastern, and Ashkenazi Jewish descent. It affects both males and females equally. The disorder is usually diagnosed in childhood or adolescence, but it can also be diagnosed in adulthood. Wilson's disease is caused by a genetic mutation in the ATP7B gene. This gene is responsible for producing a protein that helps to regulate copper levels in the body. When this gene is mutated, it causes an excess of copper to build up in the body, leading to Wilson's disease. The mutation can be inherited from either parent, and it is estimated that 1 in 30,000 people have this condition. Treatment for Wilson's disease is aimed at reducing the amount of copper in the body and preventing further damage to organs. Treatment typically involves taking medications that bind to copper and help remove it from the body, as well as avoiding foods that are high in copper. In some cases, a liver transplant may be necessary if the liver has been severely damaged by the disease. Medications used to treat Wilson's disease include penicillamine, trimethoprim, and zinc acetate. Penicillamine helps reduce copper levels in the body by binding to it and helping it be excreted in urine. Trimethoprim works similarly, but is less likely to cause side effects than penicillamine. Zinc acetate helps reduce absorption of copper from food and can also help reduce levels of copper in the body. In addition to medications, dietary changes may be recommended for people with Wilson's disease. Foods high in copper should be avoided, such as shellfish, nuts, seeds, or good meats, such as liver, chocolate, mushrooms, and avocados. It is also important to maintain adequate intake of iron and other minerals that can help reduce absorption of copper from food sources. Finally, regular monitoring of liver function tests is important for people with Wilson's disease to ensure that treatment is effective and that any complications are detected early on. The prognosis of Wilson's disease is generally good if it is diagnosed and treated early. With proper treatment, most people with Wilson's disease can expect to live a normal lifespan. Treatment usually involves taking medications to reduce the amount of copper in the body, as well as making lifestyle changes such as avoiding foods high in copper and taking supplements to replace lost nutrients. In some cases, surgery may be necessary to remove excess copper from the body. With proper treatment, most people with Wilson's disease can expect to lead a normal life with few or no symptoms. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinally.com/info. Be safe. Love you.